My name is Dr. Otabor. I'm a consultant orthopedics and trauma surgeon. Today, I'd like to talk to us about Colles fracture. Colles fracture is a fracture of the radius. The radius is one of the two bones in the arm, in the forearm. And this fracture occurs 2 centimeters away from the wrist joint. It's a very important fracture because if it is not well managed, it can lead to complications. Who are the people that are at risk for Colles fracture and how does it happen? Colles fracture happens commonly when the victim falls on both hands and there's a displacing force that cracks the bone. And this would ordinarily not happen except for 2 reasons. One, if the force of injury is very high, or 2, even with minor force, if the bone is soft. So that brings us to who are the people predisposed. The elderly women or postmenopausal women are most at risk for Colles fracture. The reason is simple. After menopause, there's a reduction in the amount of estrogen hormones that is produced. And estrogen confers strength to the bone. And so after estrogen supply has stopped or reduced to the barest minimum, the woman's bone begins to thin, and then she's predisposed to Colles fracture. So we've talked about the postmenopausal, elderly, and some other people who have diseases of the bone are also predisposed. Treatment, whatever type, whatever pattern it is, the treatment for Colles fracture used by the orthopedic surgeon. There is a technique to reduce the fracture. By reducing, I mean to bring the bone in the alignment just the way it was before the fracture occurred. And when it is reduced, the affected forearm is placed in a Colles cast. A Colles cast starts from somewhere around the distal palmar crease, and then it fell short of the elbow joint. And depending on the pattern of the fall and the pattern of the Colles will be manipulated to take a certain kind of position. And then the cast is expected to stay for 6 weeks, after which it is removed, and then the fingers are exercised by physiotherapists. And usually the fracture heals very well and there will be no consequences. But in some circumstances where the fracture is not simple and direct, like plates to hold the bones together until the fracture unites. What are the complications of Colles fracture? Well, the fracture can extend into the wrist joint, and that can lead to, that can predispose to osteoarthritis, that can also rupture in the process who have sustained severe injury. Well, those are some of the complications of Colles fracture. I hope you have learned something like that. Okay.